Are your hands and forearms killing you during pregnancy? Today we're going to talk about why your hands or forearms might hurt during pregnancy, what you can do about it, and if it's ever going to resolve. And first off, I gotta say, if you're at this video and you're like, I've never heard anybody talking about this, that is so normal, but it is a common symptom of pregnancy. Now, of course, if you have a serious pain, like when it moves, or like maybe you broke your bone is really what I'm getting at here, you obviously need to see a provider. However, if it's more of a dull, aching, maybe a deep feeling that sort of comes and goes, that is not unusual because there is pregnancy-induced carpal tunnel syndrome in here. So what happens is the extra fluid, because remember, during pregnancy, you have an increased blood volume, which also sort of just increases all the fluid in your body. That's why you might have swollen feet, swollen hands, things like that. Of course, if your swelling is crazy, definitely check with your provider, but it can build up in your forearms and cause basically carpal tunnel, but just during pregnancy. The good news is once you have your baby and the placenta comes out, that fluid starts to pull off and you will start not having the symptoms of carpal tunnel as you move forward. However, because you got to keep that baby inside a few more weeks or months, what can you be doing to make it feel better? As a side note, sometimes that carpal tunnel and the fluid that builds up can also hurt your hands and your joints. So all that extra fluid can make that carpal tunnel, but also joint pain. You might find it in other areas of your body as well. And of course, if any pain is disrupting your quality of life, you definitely want to talk with your provider about it at your next appointment. This video here is just for information so that you understand why it's happening and a few quick fixes in case you want to try them under the guidance of your provider. One of the things that you can try is cold or heat. Obviously, you don't want to have a heating pad over your belly or probably a cold pack, but using it on your arm is going to be totally fine. Some people find that icing this area or heating it really helps resolve it. I love a microwavable heating pack because it cools with time. And if you fall asleep like a pregnant girl should, then you won't be left with a really hot heating pad on your forearm. It'll cool with time. If you talk with your provider, if you only have like severe bouts at certain times, sometimes an over-the-counter pain reliever can help with this as well. Again, talk with your provider to make sure what's okay for you to be taking. Now, this is just one of the weird symptoms that we have during pregnancy. Tell me down in the comments, are you having this? Are you having other weird symptoms? Another thing is to make sure that your working environment, because sometimes this carpal tunnel is caused by how we're working, a lot of typing at work. I totally understand that. Make sure that you have good body alignment at work. You might even need to ask for a different office chair that can go up or down, or a different desk, or maybe another way to elevate your wrists as you type. And if this is a real problem, you can actually go see physical therapy and they can give you some ideas on using good body mechanics while you're at work. Other things I've seen recommended is to try strength training to make sure that you're using these muscles, as well as stretches that you can do. And again, a physical therapist is going to be awesome for that. But if you just want to try some, look here on YouTube for some wrist stretches that can really help out. As a note, sometimes our wrist pain is due to how we're holding our shoulders. And so I think it's good to do a whole upper body stretch. Usually those can be done fine during pregnancy, although make sure that you talk with your provider before you try any of these things. Have I said that enough? Thank you. I also think it's just awesome to make sure that you're moving your whole body. So things like swimming. Swimming can be great for pregnant people. And it's that one time where all of a sudden you don't feel as heavy as you might feel, especially if you're in the third trimester. Even just getting out for a walk and make sure that you're moving those arms to help blood circulation and blood flow throughout your body can help. Now, there are wrist braces that you can use for carpal tunnel. These can be a great option because you won't need the carpal tunnel surgery like a lot of people would get, but it can kind of help you get through. Sometimes you wear them while you sleep. Sometimes you wear them while you work. This is definitely something that you'll want to talk with your provider about to make sure that it's right for you. I think a lot of people worry that it's never going to go away. This is a new problem that you're going to have for the rest of your life, but I am here to tell you that it is not a new problem. Hopefully, once that placenta comes out and your body realizes it doesn't need all this extra fluid, it will go away and you'll be back to normal after you have your baby. Gosh, pregnancy is so weird. I mean, would you ever think that it would affect your forearms like this? If you have more questions about pregnancy or you'd like to get prepared with your partner, come join me in the online prenatal class for couples. I'll put the link down below. Okay, this is definitely not the only pain that people get during pregnancy. One of the things I hear most frequently is ligament pain, and I explain that all in this video. It's going to be super helpful for you. Make sure that you check it out. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.